Thank you. So good afternoon, everyone. My name is Dr. Hangaika, and I'm honored to present on behalf of our team. So today, I will be presenting our study, integrating diagnostic tests for sexually transmitted infections into symptomatic management at an adolescent clinic in Mbare, Harare, Zimbabwe. So sexually transmitted infections, especially bacterial and viral ones, remain a major public health issue. The most common ones include gonorrhea, chlamydia, trichomonas, and syphilis. They can increase HIV acquisition risk and lead to severe maternal and neonatal complications, and also cause long-term consequences such as infertility. Over 1 million new STI are acquired globally every day, with adolescents and young adults amongst the most vulnerable. Effective antibiotic treatment is available for most STIs. However, many STIs are asymptomatic and or may have non-specific symptoms, so effective diagnosis is key to effective treatment. Available diagnostic options include molecular tests, which are widely available in high-income countries, also rapid tests, and the syndromic management, which uses symptoms and clinical algorithms. Mostly low and medium-income countries like Zimbabwe mostly rely on this syndromic management. This allows rapid same-day treatment, but has important limitations like missing asymptomatic infected individuals and giving unnecessary treatment to some symptomatic patients. So the study aimed at evaluating the added value of integrating diagnostic tests. Specifically, we measured the proportion of missed treatment and over-treatment using the syndromic approach compared to diagnostic-based approach. For this study, we introduced additional diagnostic tests for chlamydia trachomatis, for Neisseria gonorrhea, and Trichomonas vaginalis, using a GeneXpert-based, which is lab-based, as well as the awesome rapid test, which was performed at the consultation rooms. The study was conducted in Mbare, one of the most densely populated areas in Harare, with residents of low socio-economic status. The MSF Mbare projects runs an adolescent clinic within the Mbare Polyclinic, which provides free youth-friendly services focused on sexual and reproductive health, including and based on the syndromic management of STIs and rapid testing only for HIV and syphilis. This was a cross-sectional study with follow-up for results. We included adolescents aged 16 to 19 years old attending the clinic for any reason and had been sexually active in the preceding 12 months. At initial consultation, clinical examination and treatment was provided based on syndromic approach, and all tests were done. For females, vaginal discharge syndrome or low abdominal pain was managed as possible infection with chlamydia, gonorrhea, and or trichomonas. For males, urethral discharge was treated as possible chlamydia and gonorrhea. We defined over-treatment when participants with the syndrome tested negative, and missed treatment when participants without the syndrome tested positive. We enrolled 402 adolescents, of which 200 were females and 202 were males. Most of these were either 18 or 19 years old, and a third of the female participants were pregnant. And 7% of the participants were HIV positive. 43% of the males and 29% of the females had 2 or more sexual partners in the preceding 2 months to enrollment, and no method of STI prevention was used by almost half of the female participants. I will now present the comparison between the syndromic and test-based diagnosis. First, I'll present the results for chlamydia. Let's start with the females. So in the study, 110 were diagnosed using the syndromic approach, and these are the participants represented in red, this one. And when we look at the test results, 65%, those ones in blue, were positive for chlamydia. And only 33 out of the 110 with the syndrome tested positive for chlamydia trachomatis, which is this 33, which represents 70% over treatment. On the other hand, only 32 out of the 65 tested positive and had not reported symptoms, therefore were missed by the syndromic approach. That's almost half of the participants, 49%. For the males, similarly, those with urethral discharge syndrome, 32 males, which was around 74% of the participants, were overtreated in red there, and 4 positive males, which is 27%, missed treatment. For gonorrhea, similarly from the 200 female participants, 110 females were diagnosed with the syndrome of vaginal discharge and are represented also in the red circle. Those with positive test results in the blue were 44, and only 34 out of the 110 with syndrome tested positive for Neisseria gonorrhea. This is the 34, which represents around 69% of the females which were overtreated. On the other hand, only 10 females out of the 44 who tested positive did not report symptoms and were missed by the syndromic approach. That's around 23% of the females. For the male counterparts, those with urethral discharge, 15 males here in red, which is around 35%, were overtreated, and only 1 male patient was positive and had missed treatment, which was around just 4%. For Trichomonas vaginalis in females, in red there, 74 represented those that were overtreated, and in blue there, the 9 represents those that missed treatment. So about 74% were overtreated, and only 26% missed treatment at initial consultation. In terms of follow-up was needed for those that missed initial visit. For chlamydia, 34 participants were missed, and of these, 25 were successfully contacted per phone, and 15 came back for consultation, with only 14% receiving the required treatment. Similarly, for Neisseria gonorrhea, there was 12 that missed treatment, and 18 that were contacted by phone. We had 6 that came for consultation, and 6 that received treatment. Overall, we had 46% that needed treatment that received the actual treatment after the follow-up. So in conclusion, high STI prevalences were noted with chlamydia trachomatis at 20%, Neisseria gonorrhea at 18%, and Trichomonas vaginalis at 9%. Comparing syndromic versus diagnostic test approach, on average, there was a 70% over-treatment for females and a 55% over-treatment for the males. And in terms of mistreatment, 20% of the females were missed and only 2% of the males were missed. Feasibility constraints were noted related to the time to getting the results as well as the cost for procuring the GeneXpert cartridges. We therefore recommend, following the study, expanding access to diagnostic testing, particularly for females, and ensuring that the test results reach participants within a short time. So thank you all to the, I would want to extend a thank you to the adolescents who participated in the study, our colleagues at the National Microbiology Reference Lab, our colleagues in the MSF, some, the MOH Zimbabwe, and the Epicent. Your collaboration made this work possible. Then a special mention goes to the late Grace Ayuelu, the former PMR for the Mbari project, and the late Andrew Tarupiwa, the study PI, both passed on in 2024 towards the end of the enrollment for the study. Thank you for your attention.